Hi guys, Dr. K with Momentum Physical Therapy and Fitness. Thanks for joining me today, and we're going to talk about Piriformis Syndrome and butt pain. So the piriformis is actually a muscle that starts in the hip and runs all the way over to part of the back called the sacrum. So a lot of times people will get pain right in this area. The important thing to know is it really coming from the butt or is it coming from somewhere else? So the first thing you want to do is make sure that it's not coming from your back. So one of the easy ways to do that is sitting in a chair. On the side that hurts, you're going to take your leg, straighten it right out, including the foot, and see if that causes any pain. The second part you're going to do, if that's fine, you still move on. You're going to slump down, head, neck, and trunk. If that causes pain into the butt, odds are it's coming from the back. Then you want to put those two pieces together. So leg, trunk, and if that's even worse than the other one, that's also causing a compression in the nerve through the back. You can lift your head up, and if that relieves it, that also means that nerve is getting compressed, but it's a little higher up. So all of those things mean that it's probably coming from your back more so than it is the muscle. But it doesn't mean the muscle can't be upset and angry and tight. So there are some great ways to actually work on that muscle. One of the first ways is to use the handy-dandy tennis ball. So you're going to find that spot of pain and sit right on that spot. With knees bent up, once you find that sore spot, you're going to take that knee and actually rotate it in and out to help release that muscle. You're going to do this until it feels better. Now, if you're sitting on that tennis ball and the pain actually gets worse, that's another sign that it's more than just muscle and that the nerve itself is getting compressed. So using this could make it worse if you're getting an increased pain as you're starting to move through this. So another way to help loosen up that muscle and get blood flow going is to use something like the derma blade to help release that fascia. So you're going to try to go right over where that muscle is. You can do it sitting, you can do it standing. You can do it over clothing. My preference is to do it under clothing, but I'm not going to show that today, with a little bit of lotion. So you're just finding which way it's the bumpiest and going in that direction. It doesn't take a lot of pressure, and you should find that that actually helps relieve some of the pain and some of the tension into that muscle. You can follow that up with a nice piriformis stretch. Again, make sure that this doesn't hurt. So after you work on loosening that muscle up, you're going to cross that leg over the opposite leg. If that feels like a comfortable stretch, you stay right there. If that causes any pain, get out of that stretch position. If it's not enough of a stretch, you're going to take that opposite leg and bring it up towards your chest. Again, you want to make sure that the stretch is not painful. If it is, it means it's probably putting tension in through the nerve. So it should feel like a nice comfortable pull. You want to hold that for a minute or so and a few times a day. What we do all day long affects those muscles. So we really need to work on stretching them out a little bit more frequently than just once a day. If you are finding that none of that is working for you, or you are finding that you were having some symptoms coming from the back, you can actually repeat that test that I just showed you as an exercise. So it's slumping down, bringing that leg down, bringing that head down, and then back up. So what should happen here is that should cause some discomfort, and then it should release that pain. If the pain doesn't go away after moving or while you are moving out of that position, again, it's not the right exercise for you to do. And I would just focus in on some of the gentler muscle or the fascia release exercises. So those are some ways to help distinguish whether it's from the back or whether it's from the butt and how to help release that. Thanks for joining me today. Dr. K with Momentum Physical Therapy and Fitness.